Hey everyone, welcome back to my channel. So in this video, I will be sharing with you tips and techniques that I've used to help me succeed and pass part 2 of the Nbeo. So basically part 2, there's a lot of clinical cases that are presented to you. You'll have anywhere from full cases to mini cases and then single individual questions that are just random. So one tool I like to use the most during the exam is the highlighter tool. What I would do is go through each case and highlight the most important information that's presented. I also like to go back and highlight the allergies in red specifically, just so that if I'm choosing medications or certain treatments for that patient, I will go back to where it's highlighted red and make sure that my treatment is not contraindicated. The test taking technique that I like to use is if they ask you something about why is this patient's vision decreased, you want to start with the anterior part of the eye and then work your way back to the posterior part. So vision was decreased for some reason in the case, you want to start anteriorly. Okay, is it something on the cornea that's causing it to be decreased? Could it be the lens? And then you kind of just work your way backwards into the posterior segment of the eye, and then just kind of eliminate the ones that don't make sense or the ones that aren't possible causes for that case. Be familiarized with different trial studies and the outcomes of those. When you're going through the case, just pay attention to the HPI, especially the onset. You can rule out certain conditions based on if you know what the onset is, whether it happened like recently or it happened a long time ago. So you can separate acute from chronic, and then you can rule out the answer choices based on what you know. So pay attention to whether it is unilateral or bilateral. Certain conditions are only unilateral and certain conditions can occur bilaterally. So if you know your conditions pretty well, you can help eliminate all the wrong choices and come to the right answer. Also pay attention to the age of the patient. That can help you rule out answers right away as well. If you're going through the full case and all of a sudden you have a feeling that it's not the right condition and you go back and change all your answers, that's just going to take a lot of time. So I would just stick to your gut feeling, go with your instincts, and stick to one condition that you think it is, and then just select your answers based on that condition, and don't go back and change, because that's wasting time and then you might not have the right answers. Sometimes they'll provide information on both eyes, but pay attention to which eye they're specifically asking about, because you don't want to choose an answer right off the bat just because the picture shows a certain condition. Just pay attention to what the question's asking and which eye in particular. So again, for me, I did utilize both KMK and OptoPrep. I did all the practice questions, practice cases, and then just get the gist of going back, highlighting the most important features or information, and then start from anterior to posterior to kind of help you eliminate some of the wrong answers. And it'll save you a lot of time. And once you know that a certain condition is caused by this, then the treatment option would be a lot easier to detect. So some questions will ask select 3 that fits the best. Sometimes you're stuck on the last option and you have 2 out of the 3 down. So if you look at the other answer choices and choose the one that most relates to the one that most relates to the other 2. Sometimes the third option is not too obvious, but if you can relate it to the other 2 conditions or the other 2 choices, then that can help you eliminate the wrong choice and choose the right answer. A lot of students like to use the Will's Eye Manual to help kind of be familiar with treatments and certain conditions, but I feel like it takes up too much time to go through the Will's Manual. So more importantly, I feel that you should just go through practice questions and be familiar with different types of ocular conditions, especially the most common ones from anterior to posterior, and just kind of have a baseline understanding of what treatment is necessary in order to treat. Know all your medications, know the contraindications, side effects, and just remember the mnemonics that you are taught, especially with KMK. They use a lot of fun mnemonics that you can remember when choosing certain drugs or medications or side effects. So yeah, those are some helpful tips that you can use in order to help you perform well on the exam.